Hello there. Welcome to Spay Neuter Network Live. I am Dr. Stickney, broadcasting from the Spay Neuter Network studio here in San Antonio, Texas. Today is July 10, 2024, and happy National Kitten Day. During the next 30 minutes, we're going to talk about things that Spay Neuter Network has going on, things that are happening in our community, and I will be taking your questions and answering them as we go along. So, first, a couple of announcements and things that are happening with Spay Neuter Network. So, as I mentioned at the beginning, today is National Kitten Day. And that is it sounds like a really fun day because everyone loves a kitten. So, this is a chance to think about kittens and all the things that they need to stay healthy, and like vaccines and having them spayed or neutered and having flea prevention for them. And we will circle back and talk more about all the things that kittens need to stay healthy here if we have time later on. July is National Lost Pet Prevention Month. And you can find details about this on our website at spayneuternet.org. But I will say that July 4, Independence Day, is the day that more animals go missing and run away from home than any other day in the entire year. And the reason for that is because of all the fireworks and noise, and animals get scared and they take off. A lot of animals have noise phobias, or they're just not used to that much commotion, and it scares them. And then the next thing you know, they are gone. One of the most reliable, the most likely way for you to recover your pet if it's lost is to have it microchipped. The microchip is a permanent identification for that pet that is tied to your contact information. So when that pet is found and taken to a animal shelter or to a veterinarian's office, they can scan the dog for the chip. It comes up with a unique number. The number is then used to contact you, and you are able to get your pet back. If your pet does not have a microchip, now you're depending on people seeing a flyer that you put up, calling around to different places. You don't know where your pet could be. You know, your dog looks like your dog, but to a lot of other people, your German Shepherd, for example, looks like another German Shepherd, and they don't recognize it for your pet. So having that permanent identification is really critically important. And having your pet microchipped is something that we can do at Spay Neuter Network. Other things that we have going on here in San Antonio is we have a transport program where we have a vehicle, nice air conditioned vehicle that we will send out to pick up pets for their procedures, for their spays and their neuters. And during the month of July, we are doing free transports. So there's a little extra fee when we transport your pet, and this month that is being waived. So there are more details about that at spayneuternet.org as well. If you need to get your pet vaccinated, particularly your kitten, on National Kitten Day, we are having $5 off of all of our vaccines in July if you sign up for our newsletter. And you can sign up for that newsletter at spayneuternet.org. I say that website a lot because it's one of the most important websites there is. If you sign up for our newsletter and then bring your confirmation email with you when you bring your pet in for vaccines, you will get $5 off your vaccines. So go take a look at our clinic vaccine hours and details at spayneuternet.org. We are always looking for volunteers to help us at our clinics and at events. We love to reach out to the community. We love to be a voice for pets and providing affordable preventative care for animals and helping people with their pets. So we have clinics and we show up at different events for those types of things. And we always need volunteers to help us because it's a lot of places to be and a lot going on. If you would like to help Spay Neuter Network do some of these things and help your community, click on the Get Involved button at our website at spayneuternet.org and follow the instructions there and the prompts, and we'll see if we can't help get you involved in some things that we have going on. If you live in the Dallas area, we have several free vaccine clinics going on in Dallas. You can find all of the details on our Facebook page or on our website. A couple of those will be, one of those will be this Saturday at the West Dallas Multipurpose Center, and then at the end of the month, July 27, at Dallas Animal Services. So all of the information, times, and locations is all going to be at our website at spayneuternet.org. So go check that out. Sign up for our newsletter and get all of the information that you need there, and see if they can get involved and help us in our mission that we have. So let's take a look at some questions. I have one that came in here ahead of time, and this question is from Raquel, and Raquel asks, why can't they sterilize a dog that has epilepsy? So that is there's a lot to unpack in that question. So we'll just kind of go through a few things to consider with that. So first off, you definitely can spay a dog that has epilepsy. The thing that you need to consider is, are any of the risks worth the benefit of doing? Are there any risks that make it not being of benefit to do? So the first things that you would need to consider, that the veterinarian is going to consider, is what is the reason that this dog is having seizures? Is it idiopathic epilepsy, which means that they just have seizures? There's just something kind of wrong with the way that their brain fires sometimes, and they have seizures, or are they having seizures because there's some type of other underlying disease like liver disease? So if it's something like liver disease, you're going to want to be more cautious with any kind of anesthesia, because so many of the drugs that we use for anesthesia are broken down by the liver. You need to have a functioning liver for that. If your dog has idiopathic epilepsy, the next question to ask is, how well is that epilepsy controlled? There is some evidence, I shouldn't even say evidence. There's some weak correlations and data that may suggest that spaying or neutering a pet can make their epilepsy be less well controlled, but that's information primarily in people, and really nothing that is concrete in veterinary medicine. So, this is a discussion to have with your veterinarian. Are our seizures well controlled? Is our liver function good? And then is this a procedure that we reasonably can expect that there'll be few to no complications from? So it's an individualized thing. There's lots of different factors to consider, and those would be some of them to talk with your veterinarian. All right, we also have had some questions that have come in while I have been talking. So let's see here. What do we have? My dog and cat keeps biting their paws and itching. Is this a sign of food allergy? Not sure if I should change my dog's food or not. Okay, so that is a great question. Itching paws. That is a sign of allergies. Now, whether or not it's food allergy, maybe not. But with people, we get allergies to pollen, the grass, whatever's in the air that blooms at certain times of years. We get runny noses and we get itchy eyes. That's what happens to us, and we sneeze and we don't like it. So with dogs get itchy paws and itchy ears when they are allergic to things in the environment. So that would be something that I would definitely consider. Not necessarily food allergy right off the bat. The most common cause of allergies here in the state of Texas are environmental allergies. So that would be where I would start. And we have so many different options now for treating allergies in dogs that have far fewer side effects than things we used to do a long time ago. So this is definitely something to go and visit with your veterinarian about and see what options are best for your pet. It would not hurt to change your dog's food, but if you're worried, if you're concerned about a food allergy, the trick to a diet change is to have a protein source in that new food that they've never been exposed to. So, so you would be looking at some of the more exotic types of diets as a protein source. So, not chicken, not beef. If your pet's never had a lamb and rice diet before, that's a possibility for changing it. But I would consult with your veterinarian first and see if that's something that we even need to do in the first place. All right, another question. I had my kitty spayed back in April. She still has a stitch. Is that normal? So yes, it's not necessarily normal, but it's not abnormal. Just it happens sometimes. So the the suture that we use is absorbable, so it's supposed to break down over time, and the body breaks it down. But sometimes that just it just doesn't happen like that. And you'll have one little stitch left over. So it will not hurt anything, but absolutely bring it by during our wellness time, and we can snip out the stitch. So we can get that taken care of. My male cat has been shaking his head a lot, and some kind of liquid comes out of one of his ears. Does he have an ear infection? So that does sound like he probably has an ear infection. Shaking head in cats, that's a common sign of them having ear infections because their ears itch and they're clogged up. And in this case, they've got it's like when you've gone swimming and you get water in your ear, and you're trying to do this and get the water out of your ear. It's the same sensation that the cat has. So the cat's shaking his head because he's got fluid buildup in there from whatever is causing the infection. So you'll want to take him to the veterinarian so that they can determine what the cause of the infection is and get that treated, and get your cat back to his regular happy self. So, as we're waiting for more questions to come in, we'll go ahead and roll back around to cats and kittens. And if we have other questions, I'll just pause and we'll answer those questions. So, things that we need to do to have a healthy kitten. First off, kittens need to have access to fresh water all the time, and they need to be on a kitten type of a diet. Depending on the age of our kitten, if it's a younger kitten, 5, 6, 7 weeks old, that kitten doesn't have really strong jaws yet and just has teeny little teeth. So wet food for them or dry food that you moisten with some water so it's kind of mushy will be the easiest way for them to eat as they're growing. They also need to have a litter box, and when you're a little kitten, it has to be a litter box that they can actually physically climb into and out of. If it's too tall and they can't get in there, then that's just not going to work, and they'll end up doing their business just outside of the litter box instead. So we want to make sure that we have a litter box, and the recommendation is that you always have one extra litter box than you have cats. So if you have one kitten, you're going to want to have two litter boxes in different areas of the house. And that way, some cats are very, very fussy about how clean their litter box is at any given time. So there's always another one there that they can use. So those are like the first three things that we need to keep in mind. Then we need to make sure that our kitten is healthy and stays healthy. And one of the best ways to do that is through vaccination. Vaccination is the second most important thing that has saved lives in people and animals, second only to clean drinking water. So it is so vaccinating them, especially as kittens, is a very important thing to do. Here is a question that popped up. I have a feral that just had kittens, but I don't think she's producing much milk. What can I use to help her? Okay, so the if the kittens are napping a lot and then eating and napping, and they're not doing a whole lot of meowing all the time, then they are getting enough milk for what they need. So that would be the first thing to think of. They're gonna go frequently to nurse, but they're not necessarily going to get a whole lot all at once because at this age their tummies are about the size of a thimble, so they're really small. So it doesn't take much milk to fill them up. So they may be getting all the milk that they need. If they seem like they're generally content, then we're in good shape. Um, the cat wants to have a nice high protein diet right now. So if this is a cat that you're feeding, you want to make sure that they are on a good quality cat food that you're putting out for them. Finally, the other thing would be that, if she's not making as much milk as she can, there's really no way that we can jump start that for her other than trying to make sure she has a good plane of nutrition. So then you would be looking at potentially trying to bottle supplement these kittens with some milk replacer. Depending on how feral the cat is and the kittens are, that may be something that's a challenge to do, but that would be the other option. Okay. So, vaccinations, speaking once again of kittens, vaccinations for our kittens. There are what we recommend at Spay Neuter Network is that we start at 6 to 8 weeks of age with their first vaccine, and then we're going to give those vaccines about every 3 weeks after that until they are about 3 months old, a little over 3 months old. The first vaccine that the kitten is going to receive is going to be called an FVRCP vaccine. And all of those letters stand for feline viral rhinotracheitis, calicivirus, and panleukopenia. And those are all three of the most common diseases that kittens can get. And so we'll do that vaccine as the first vaccine for them. And then we will see them back in 3 weeks. It'll be about 11 weeks for the next vaccine. And we're going to boost that FVRCP vaccine again. And then they'll be old enough to get their FELV vaccine. And we will we'll touch back. We will try that again. We will circle back around to that in a moment because we have more questions that came up here. Let's see. She also okay. So regarding the feral cat, let's see. She left for 2 days and was stuck with her. Okay, hang on here. Come back here. How would I know if she's pregnant? I was told that she could have gotten pregnant again. So it is certainly possible, but she is unlikely to get pregnant until those kittens have weaned. So because her uterus is in the process of involuting right now, which means returning back to a normal size. A normal cat uterus is about when they are not. I'm trying to find a visual aid here. When they are not pregnant, their uterus is about the size of a pencil, the uterine horns, and then those balloon out to be about as big around as a baseball in diameter when they have those kittens. So that uterus has to go back to a normal size and shape. But once those kittens are weaned, bringing her in to have her spayed would be a great idea because that way we will be able to control those number of kittens that are out running around, and it'll be one less thing to be concerned about. My cat has a dry spot on his skin, and his mom used to have red patches on her skin too. We are not sure if it's hereditary. Okay, so it could be. There's a few different things that we think of when we see those kinds of spots on cats. So one of them is ringworm. And that is something that cats usually get that from the soil, but once they get it, they can spread it from cat to cat, and it also can spread to people as well. So that would be one thing to keep in mind. Another reason would be if they have external parasites like fleas, or if they're getting a tick on them. Sometimes they may scratch and chew so much that they lose some of their hair there. So I would recommend getting that spot checked out, making sure that it's not ringworm, and having that cat placed on a good monthly flea preventative. Oh, thank you for doing this every week. Well, I enjoy doing this, and I'm glad I'm able to do it and reach out to everybody every month. I guess I do this every month, so thank you very much. My Great Pyrenees puppy drinks a lot of water and he pees it out right away. Is that normal for him to drink and do that a lot? And that is absolutely normal. So puppies drink a lot of water, and they do that because their kidneys have not fully developed yet. So one of the biggest jobs of our kidneys is to make sure that we always have enough enough fluid in our bodies. So when we drink water, if we drink a whole lot of water, we pee more often. But if we are not drinking as much water as we should, then the kidneys will concentrate that urine, and we don't urinate as often. With puppies, they're not able to concentrate their urine yet, so they will drink and drink and drink, and pretty much what they drink, they'll pretty quickly pee that out. So that is totally normal, and that is one of the biggest reasons why we want them to always have fresh water available all the time. And as long as they have that water, they're going to regulate themselves and make sure that they have the fluid they need in their bodies. But that is perfectly normal for a puppy and a kitten. Can you spay a cat at 8 weeks of age? Absolutely, you can. At Spay Neuter Network, that's our recommendation: is that 2 months, they're good to go. 2 months, 2 pounds, we can spay them, we can neuter them, and that is just an ideal time to do it. Those little kittens, they heal so fast. They don't even know we did anything to them, so it's a really easy time. All of the blood vessels that go to those tissues are really small, so it's a great time to do that procedure. The other benefits of doing it so young, especially if you are, especially for the male, well, all of them, but the male cats, if they're in our house, we sure don't want them to get old enough that they realize that they can start marking their territory, because that is a mess, and that is a hard thing to clean up. And once a male cat decides that he likes marking his territory, he'll tend to keep doing it. So if we can neuter him before he ever hits sexual maturity at about 6 months of age, we're not going to have to worry about that. So 2 months is fantastic. With our kittens, with our female cats, again, 2 months is great. It's a really easy procedure. It eliminates the risk of them ever getting any kind of mammary cancer, which has a very poor prognosis. They don't do well if they get mammary cancer in a cat. So you want to not have that happen. And then, once they're 6 months of age, they can start breeding and having kittens. And the first step in that, the first part of that is going to be that they will drive you crazy if they're in the house, because they're going to be wanting to rub up on everything, and they're going to be doing this wow, wow, all hours of the night, and you'll know real fast that it's time to get them spayed. So get it done as early as possible, and that's not an issue either. All right. So yes, 2 months is perfect. Let's go ahead and get those pets into the hospital. You can book an appointment with us on our website at spayneuternet.org. Okay. Let's see here. Is 10 minutes too long for them to be outside with shade for feeding and a bathroom break? No, no. It's really hot. It's really hot, and it's really humid, especially here in San Antonio. So I would say, and what I do with my own pets is 20 minutes is the cutoff. That's when I call everybody inside. It's after 20 minutes, and that way they've got time to do their business. And they've usually barked at somebody through the fence, and someone has usually gotten very upset at the squirrel jumping around in the trees. And then, okay, time to come back in and get cooled off. So 10 minutes is fine. I think 20 minutes is fine. The key there is that they've got water and a cool place to go into afterwards. Okay, great. Okay, so for one of the reasons, so I was talking about vaccinating our kittens, and we boost them, so we give them a second vaccine at 9 to 11 weeks of age. Why do we have to give them a second vaccine? Isn't one going to be enough? And the answer is one is good, but there is study after study has shown that you get a much better immune response to those vaccines, and then an ability to fight off those diseases after that second vaccine. The first one kind of primes the immune system to say, oh, I actually have a job to do, and I need to recognize these things and go and fight them if they show up in my body. The second vaccine is like now in good shape, and now I'm going to the gym and working out all the time. Now that immune system is, yeah, let's go not get sick. So it really makes a big difference there. The other reason that we have to do a series of vaccines, because we'll typically do about three vaccines in the cats, is because there is a thing that baby animals, cats, dogs, people, are born with that is called maternal immunity. And maternal immunity is some of the antibodies that the mother had will get into the bloodstream of the kittens, and that is to help prevent them from getting diseases, the day that they're born. That will eventually wear off, and then their little kitten immune systems are on their own to figure things out. The problem is that we never know when that maternal immunity ends. So we give that series of vaccines so that we are certain that at some point we're going to be actually stimulating the kitten's own immune system with the vaccine, and not just have them depending on what mom left them. So that's why we do a series of vaccines, and that's why it's important to complete that series. At about 3 months of age, then that's when we will give that third vaccine. They're going to get their FVRCP booster and their feline leukemia virus booster. And then at 3 months of age, that is when they are able to legally get a rabies vaccine and have it count on the little rabies tag and rabies certificate. So that 3 months there is a critical age for vaccines, because we need to get those rabies vaccines on board as well. So the other thing that we'll want to do with our kitten is to get him microchipped, so that we can, should our kitty run off, we will be able to have a better chance of finding him and getting him back in our home. The other thing that we're going to do with our kittens is deworm them. We're going to deworm them frequently. Every time that we see them in for vaccine boosters, we're going to want to give them a little dewormer as well that will treat hookworms and roundworms. Most puppies and most kittens are actually born already infected with hookworms, because those are able to get through the placenta into those little into the puppies, and they'll already have that parasite the day they're born. And you're not necessarily going to know it or see it, but if you've ever seen those little kittens and those little puppies that look like they just have that really big round pot belly, that's because they have GI parasites. So we're going to deworm those kittens every 3 weeks at the same time that we do our vaccines, our vaccine boosters. And then finally, we are going to want to get them started on a flea prevention and heartworm prevention. All of the flea preventatives that we use for cats are also effective against heartworms. You don't think about cats getting heartworm disease very often, unlike in dogs, where that's a big problem for them. Cats are not the preferred host species for heartworms, but sometimes they will get an infection from a heartworm, and those infections are very hard to diagnose. And the number one sign of a cat having heartworm disease is sudden death. They just fall over dead because of the inflammatory response they have to that worm. So Celerid is a product we have at Spay Neuter Network. It's one of the topical monthly products, and that will take care of heartworms and of all of our GI parasites. So those are some things to keep in mind on Kitten Day, National Kitten Day, to keep our kittens safe and provide them with the best chance at starting out their little lives on the best 4 feet forward. We talked about a lot of things today and a lot of events that are happening. Remember that you can find all of the detailed information and review anything that I've said from on our website at spayneuternet.org. While you're there, sign up for our newsletter, and print out that or download that email that says you're now on the newsletter, and you'll get $5 off of your vaccines when you show up to get your pet vaccinated. We have free clinics going on in Dallas this month. At this Saturday is one of them at West Dallas Multipurpose Center. At the end of the month, July 7 at Dallas Animal Services. All those details are going to be on our Facebook event page or on our website. If you're in the San Antonio area and you need to have your pet transported to our clinic for its spay and its neuter, this month it's free. Find the details at our website. And remember that July is National Lost Pet Prevention Month. So if your pet is not microchipped, think about getting that done. It was great speaking with everybody today. Y'all have a wonderful day, and we will see everybody next month. Thank you. Bye bye.